The way you interact with caregivers and their children affects how they feel about immunization. Calm, clear communication can build trust and increase the likelihood they will return for the next session. In this video, we will look at what makes good communication during an immunization, as you greet the caregiver and child, explain key information, vaccinate the infant, and remind the caregiver to return. As you greet the caregiver, keep in mind that effective communication is more than just sharing information. It also involves tone of voice and body language. Welcome each family with a smile and calm manner. Thank them for their patience if they had to wait. Ask the caregiver if they have any questions or concerns and answer them politely. Remember that many caregivers may feel anxious. Observe the caregiver's body language. Show concern and empathy and treat caregivers with respect and courtesy. Take interest in each individual and listen without judgment. Note any mention of health problems in the community that need to be reported and addressed. Next, patiently explain key information to caregivers. Write the date of the vaccinations being given on the immunization card and explain the diseases they protect against. Use simple terms in the local language. A poster or chart can help you explain better. Explain the need for the child to return for each contact in the immunization schedule to be fully protected. Use the immunization card as an instructional guide and congratulate the caregiver if the child has completed a series. Ask questions to make sure the caregiver understands. Write the date for the next vaccination on the immunization card and tell the caregiver. If appropriate, associate the date with a well-known occurrence, such as a holiday or seasonal event that will help them remember to bring the child back. Ask the caregiver to repeat the date to be sure it is understood. Explain that if the child cannot come on the return date, they can obtain the next vaccination at another location or another date close to the due date. Explain possible adverse events and how to handle them. When you are ready to vaccinate, be sure to describe positioning to the caregiver. Throughout the vaccination, remain patient and calm. Of course, it is important to develop skills for giving one or more injections quickly, safely, and with little discomfort. Your confidence will be reassuring. After the vaccination, remind the caregiver when to return with the infant and to bring the immunization card when they bring the child back for the next vaccination. In the event of any out-of-stock vaccines at the time of the session, inform the caregiver where and when to return for the next doses. This is also a good opportunity to remind the caregiver about other services such as vitamin A supplementation or tetanus toxoid for women. If immunization campaigns are planned in the coming months, inform the caregivers about the date of the campaign, what vaccination is being given, and where the vaccination site will be. Offer relevant print information to caregivers who are literate. When the session is done, always ask the caregiver if they have any more questions or concerns and answer them politely. Of course, thank them for bringing their infant to the session. Now you know how to make good communication part of each immunization session.